else, I should be ready to talk when I hit the gavel. Good afternoon, everybody. We're calling the meeting to order. Can we have a roll call, please?
Mr. Young?
Here.
Mr. Furman gave notice that he was not able to attend. Mr. Cohen?
Here.
Mr. Torres indicated on the sheet that he's not going to be in attendance. Pastor Jones?
Here. I did it twice.
Dr. Hans gave notice that she's going to be running a little bit late. Ms. Newman? Sorry.
Present.
Ms. Root? Here. Ms. May? I didn't get any notice. Ms. Woodruff? Here. Dr. Giles? Mr. Landsman?
Here.
And so we have quorum on the Finance Committee, and we have 50% of the Policy Management Committee. So.
Question, as board chair, am I also an ad hoc member of the policy and gives them a quorum?
Yes.
Okay, then we're good on that side.
Thank you. Next, we have our first opportunity of public comment. Is there anyone on the line requesting to speak? Nobody? Okay. We have one in the audience that would like to speak.
Hi, Fred Jones, President of Alliance for the Mentally Ill of Oakland County. I want to talk to you a bit again about the book that I talked about once before, Belonging by Jeffrey Cohen. I think it's very important to people understand about people who have mental illness who need to belong to something. Many of them are isolated in independent living. Many may be in group homes, but the people in group homes keep moving, so there is not this thing kind of togetherness if you have belong to a group of people with friendships. So turnover in those homes plus turnover of staff is a problem. Clubhouses are great, and that is belonging. The difficulty is, first of all, a lot of people don't get into the clubhouse because they don't qualify for one reason or another. And when people get better, they get tossed out of the clubhouse. So they go from having a lot of friends and involvement to boom, now they're making money so they can't be here. And that can be traumatic in itself. So that's a concern for people with mental health. But we also need to be concerned about the issues with children who did not have school during COVID. And it sounds like there's a lot of that problem emerging is that people look at people who are having problems after graduating or while in school. And I think a big part of that is basically they haven't had the social relationships that you normally develop in school. We should be recognizing that school is where you can get socialized, where they learn how to work with others, and they kind of learn who they are. And that's very important. If you come out of high school and you haven't had that experience, you're kind of lost. Don't yet know who we are. So that's very important. And I think that's also an issue to be addressed in solidarity because we're dealing with mental illness and schools. And I think schools have a big issue here that I don't think they understand belonging. They have classrooms, but people don't belong to a classroom. They're in a classroom, and they get taught, and they're supposed to learn reading, writing, and arithmetic, but they're not supposed to learn about getting along with others. They may learn something if they go out in recess, but lately they're not going out in recess because of COVID and other things. So teachers need to understand about belonging and about what the importance of that for children from the time they get into school to the time they graduate. They need to belong. And when you've got a kid in a schoolroom who's not getting along, the answer is not to throw them out. The answer is to engage them, and to get other people in the room to engage them. So it's a different thinking about what the role of school is. That this is about belonging to the school. So people who can participate in sports, they have a belonging. But the people who aren't in sports, well, they need to find other things. So anyway, again, very important book, both for mental illness and for everybody else that goes through school, and probably beyond that, that most of us end up in our lives belonging to things for lengthy periods. And that's who we are. Thank you.
Thank you, Mr. Cummings. Is there anyone else that would like to give public comment at this time? Thank you. If not, then we'll go on to approval of tonight's agenda. I need a support.
So moved.
So moved. Support.
Support.
It's been moved in second. All in favor? Aye.
Aye.
Any opposed? Motion carries. We turn it over to the Finance Department.
Thank you very much. Finance Committee has two contractual matters to review this evening. And the first one is Kingsway Landscaping. Adam, do you want to give us an overview of what you need?
Yep, these ones are kind of boring tonight. So the first one is Kingsway Landscaping. The proposed amount for the year is $40,000. That's the annual amount. Mark was able to negotiate it down to $150,000. Thank you. I think I'd learned by now. So it is $45,000 annually. So this is for the upcoming year of 4/30 of 23. Wait a minute, that's not right. Mark, when does this go till? Through 2024, thank you. And this is just for our snow removal here at the Troy location,
Okay.
salting and snow removal.
And how I read it was we need a short extension, or we're going to do this.
This is for that's for the other contract. This
Right.
one is just for the
Oh, this
upcoming
is for the snow removal?
Yes.
Okay, good.
Yep.
Okay, I got it. Okay. All right. The other one is for the,
a small extension.
yeah,
Correct.
right, okay. All right. All right, so, had a presentation. Is there any discussion with members of the Finance Committee? There being none, do I have a motion?
I'll make the motion to recommend moving this to the full board meeting next week.
Support.
Support, thank you. Yeah, there was no discussion, so if we can have a roll call vote, please.
Mr. Young?
Yes.
Pastor Jones?
Yes.
Mr. Cohen?
Yes,
Motion carries.
thank you. The next is our, building maintenance contract and security. Adam?
Yes, and this one is the extension.
That's, okay, yeah, got
Yep.
it right, yeah.
This is for CPI. The CPI provides the security services for this building, which include card reader access, door hardware for the security systems, cameras, and software for the cameras. We did have an RFP that went out within the normal 90-day time frame. We did not receive any bidders interested in this. So therefore, we need to do an extension, and the extension will cost $20,000, and will still stay within the not to exceed amount of $466,000 for the duration of the contract. And this service does also cover the tenants that we have in the building, so this is for everybody in the building. We are going to release another RFP, so we hope to get some more bidders this time around.
I assume we're gonna make a more proactive approach on the bidders.
Yes.
Yeah. I mean, just based on my knowledge of some, and association with some property management firms, I think the biggest problem right now is having enough staff. It's very hard to staff, and, since COVID, and so, that may be the reason why we didn't get any bids.
Yeah, it could be, and we're definitely going to do that, more proactive push this time around and
Okay.
see who we can get.
All right.
Mr. Treasurer?
Jonathan?
Thank you. So do I understand this, that not even CPI bid on the RFP, but we're doing an extension with them?
That is correct, they did not bid.
Did they indicate why they didn't?
I'm gonna reach out to Mark again. Mark, did they say?
Thank you.
Thank you.
Mark Duguid, manager of facilities. They did express that their estimator was on vacation. We ran into a lot of that during the summer, so we extended it this time out.
Thank you.
Good. Any discussion among the finance
So-
committee? Yes.
What that leads to, so then they plan to, respond to the next RFP?
That is correct. Part of the process is to give us a confirmation of interest. The second part is to provide questions. They provided about 5 questions, so we know they are interested this time.
Okay, all right, thank you.
Any further discussion or questions? There being none, entertain a motion.
I'll make the motion to recommend this to go to the full board meeting next Tuesday.
Support?
Motion and support. Roll call vote, please.
Pastor Jones?
Yes.
Mr. Young?
Yes.
Mr. Cohen?
Yes.
Motion carries.
The business of the finance committee is completed. I didn't see anything, yeah. Except for, the director would like to make a statement on the financial statement.
Yeah.
Or financial report.
Typically, we would have a financial report for this month. And working very, very closely with our consultant Raymond Group and Richard Carpenter, he has recommended an update of a module in Odin, which would better align with Business Central, our new software that we're using on General Ledger. So once we make those changes, we'll get a better report. He's actually using it in other areas, and he thought this was something that would enhance our ability to give definitely more reports, but assuring more accuracy in our reports as well. So we want to defer that until we get those things done.
So we should have it at the board meeting?
Our hope is to have it by next week at the board meeting, and if not, I'll let you guys know in plenty of time.
Okay.
I have a question for, our CEO. Because that is an extension to, PCE software, are we expecting an additional charge or fee from PCE to adopt additional functionality?
I don't believe so, because it's a module that's readily available and used in other areas. So I'm not sure if they'll charge us for that or not. Do you know, Nathan?
They typically charge for
I-
everything.
well,
That's why I
I-
wondered
yes, I
if
know
Jeff was
that.
gonna invoice us.
Nasser Doss, Chief Data Officer. Usually PCE do not charge per every single screen or module, or unless it's really a huge thing, but just for a report or whatever, what we pay them on a monthly basis usually covers all of these services. As we speak right now, we have a big list of other things, from to recipient rights to you name it, and they are working with us diligently on implementing these things. So it's an ongoing business.
Thank you.
Thank you.
Okay, now the business of the finance committee is concluded. Thank you, Dana, for the update.
Now we have a policy management side of the meeting, suicide prevention proclamation. Suzanne?
Good evening, everyone. Suzanne Weiner, Director of Communications. I think I'm going to be up here for a few minutes, so got a couple of proclamations I'd like to present to the board. As you know, each year, OCHN brings awareness to both Suicide Prevention Month as well as Recovery Month, and that's coming up in September. So we would like to bring the proclamations before you. Typically, we work with our local municipalities and school boards. We send the proclamations out both via mail and electronically so that they have this information and they can bring awareness in their communities as well. Typically, we've gotten in the past quite a few requests for in-person acceptance of those proclamations. The last couple of years, it's been a little bit less, but hopefully we'll get some requests this year. But oftentimes they'll present that proclamation and accept it at their local municipalities or their school boards, and they send that to us as a confirmation that they recognize that proclamation. So that was just a little bit of background on what we do with the proclamations and how we create some awareness for both Suicide Prevention Month and Recovery Month. So if it's okay, I would like to go ahead and read the proclamations. I can start out with the Suicide Prevention Proclamation, and then we can move on to the Recovery Month Proclamation. National Suicide Prevention Month, September 2023. Whereas September is known as National Suicide Prevention Month and is intended to help raise awareness surrounding suicide prevention resources available in the community, and whereas World Suicide Prevention Day is observed each year on September 10th, and whereas suicidal thoughts can affect anyone regardless of age, gender, race, orientation, income level, religion, or background, and whereas, according to the Centers for Disease Control and Prevention, CDC, each year more than 48,000 people die by suicide. And whereas suicide is the second leading cause of death for people 10 to 34 years of age, the fourth leading cause among people 35 to 54 years of age, and the eighth leading cause among people 55 to 64 years of age. And whereas organizations like the National Alliance on Mental Illness, or NAMI, and National Suicide Prevention Line 988 work to help individuals in crisis and provide resources to shed light on this highly stigmatized topic. And whereas every member of our community should understand that throughout life's struggles, we all need the occasional reminder that we are all silently fighting our own battles. And whereas Oakland Community Health Network, OCHN, is committed to being a zero suicide organization and cultivate a network of providers who are engaged in the zero suicide philosophy. Now therefore be it resolved that Oakland Community Health Network hereby recognizes September 2023 as National Suicide Prevention Month. OCHN calls upon our citizens, government agencies, public and private institutions, businesses, and schools to recommit our state to increasing awareness and understanding of suicide prevention and the need for appropriate and accessible service to assist individuals in crisis. And that is the completion of the proclamation. And are there any questions?
Are there any questions? Oh, go ahead, Dennis.
So when is that going to be distributed to municipalities and school districts?
We're distributing it this week.
You're going to send it out this week? Yeah.
Yes.
Okay. Because to get it on, there's a lot of meetings that you get cancellations on Monday meetings because of Labor Day, but then after that, they all pick up again. And
Okay.
a lot of school boards have they don't meet over the summer, all of them. So, yeah, if you can get it on their agenda, that's great.
Yeah.
Thank you.
Thank you. I'm wondering if we could add to that religious organizations, because I don't see a reference to religious groups or what have you, and I think that there is a high incident of suicidal rate within the religious organization, and or at the end of such an event, there's a suicide. It's not an event, but it ends up being thrust on the church as well. So if we could add that to give further recognition that we are concerned as an organization, OCHN. I hope you guys can hear me. With not only what's happening within our community, but within our churches, this touches so many lives. So if we could add that, I would appreciate that.
I will leave that to the board. A suggestion might be faith-based organizations versus religious organizations, if that is okay with the board.
Faith-based, I'll take faith-based religious groups, OUs. Thank you.
Yes, are you looking for a motion to adopt this proclamation?
Yes, I'll entertain a motion to adopt the proclamation from the Policy Committee.
As
I-
amended?
As a member of the Policy Committee, I move that we accept this proclamation with the stated, correction or addition of religious organization.
Okay, thank you. It's been, excuse me, moved and supported. Is there any discussion on the motion? All in favor say aye. Aye. Any opposed? None, thank you.
Thank you. I'm going to stay because I have another proclamation to read. Okay, similarly to the Suicide Prevention Month proclamation, we are going to be sending an additional, they'll actually be going out in the same mailing, because it is also Recovery Month in September, and we also provide a proclamation and asked our local municipalities and our school boards to also read that proclamation, or if, we always suggest if we want someone to come from OCHN to accept that proclamation, then we're always happy to send someone to accept those proclamations. So I'll go ahead and read that proclamation as well. National Recovery Month, September 2023. Whereas according to the Substance Abuse and Mental Health Services Administration, or SAMHSA, in 2021, 16.5% of Americans, or 46.3 million people, 12 years or older, were classified as having a substance use disorder in the past year, including 29.5 million people who were classified as having an alcohol use disorder and 24 million people who were classified as having a drug use disorder. And whereas according to the Centers for Disease Control and Prevention, CDC, over 105,000 overdose deaths occurred in the United States in 2022, a 2% decrease from 2021. And whereas substance use recovery is important for individual well-being and vitality, as well as for families, friends, communities, and businesses. And whereas OCHN continues to educate and raise awareness of the risks and potential harm associated with prescription drug misuse, and whereas stigma and stereotypes associated with the substance use disorder often keep people from seeking treatment that can improve their quality of life, and whereas substance use disorders occur when the recurrent use of alcohol and/or drugs cause clinically or functionally significant impairment, such as health problems, disability, and failure to meet major responsibilities at work, school, or home. And whereas substance use disorder recovery is a journey of healing and transformation, enabling people to live in a community of their choice while striving to achieve his or her full potential. And whereas substance use disorder recovery benefits individuals with substance use disorders by focusing on their ability to live, work, learn, and fully participate and contribute to society and enriches the community culture. Now therefore be it resolved that Oakland Community Health Network hereby recognizes September, should say 2023, I'm so sorry about that, I thought that was corrected, as National Recovery Month. OCHN calls upon our citizens, government agencies, public and private institutions, businesses, faith-based organizations, and schools to recommit our state to increasing awareness and understanding of substance use and the need for appropriate and accessible services to promote recovery. And that's the completion of the proclamation. Does anyone have any questions?
Yes.
I was just wondering if in the second whereas from the bottom, so substance use disorder recovery is a journey, could we replace his/her with their, just to go along with the gender affirming language? Thank you.
Absolutely.
Sorry, I did not hear what she said.
Oh, could you repeat what you said?
I just asked if we could replace his/her with the word their, so that way it's gender affirming language.
Thank you.
Yes.
And, right, okay. And again, and this may be a moot point, but how are we defining citizens? And the reason I'm asking that is because it doesn't reference, the different ethnics or cultures. And I'm just wondering, how limited or how broad do we want to get? I guess that would be the thing, because we know that we have substance abuse and all of this within the different ethnics and cultures, okay? Some even more than others. And so I'm just wondering if maybe we need to expand that, our citizens, and of course, there are non-citizens too, I guess, but if we could expand that?
If you want to refer to it as individuals versus citizens, and maybe that would be a little more encompassing of the individuals that you're talking, or the people that you're talking about. Okay, we'll do that on both proclamations if that is agreeable with the board.
That would fit what I'm asking, so it makes it more inclusive. I don't know how everybody else feels about that, but I do think that we need to make that very inclusive. And since we're saying we want the state to get involved in it as well.
Great suggestion, thank you. Any other suggestions or comments?
No more comments or questions? I'll entertain a motion to approve, from the policy committee to approve the proclamation to be moved to our board meeting next week.
I make the motion that it's moved to the board meeting next week with the 2 noted corrections.
It's been moved and supported. Any questions on the motion? Hearing none, I signify by saying aye. Any opposed? Motion carries. You're next too.
Thank you, I am next.
She gets the frequent flyer award.
Yes, I am. Glad to be. All right, I'm going to go ahead and have you move it to the next slide. I'm going to give a little update about what we have going on in August and September. As you know, September is a very busy month for us, and August has also decided to be a little bit busy as well. So these are good things that keeps us on our toes, and it's part of the job. So one thing that we just recently did last week was we do this annually, the Auburn Hills National Night Out. Very successful event, always quite a few people that attend that event. Just had an event last night. Quite a few of us were on a cruise last night. It's the Everybody versus Stigma Cruise. It's such a great sponsorship for us, and it's such a worthy cause. It was very well received by OCHN. We had a little bit of rain, but it all worked out, so it was a great event. Also have some other workshops coming up that we're working with open schools. Then something really big coming up is the CIT International Conference coming up. That's a 3-day conference coming up mid-August, and OCHN has helped plan that conference. We're participating, and Dana is actually providing the opening remarks. So that is coming up on August the 14th through the 16th. As well as we have our advocacy work group happening during that time as well. So you can see we're keeping very busy even in August. Your Voice, Your Value, this is one of our favorite events. It's our annual conference, and it's an opportunity to honor the people that we serve. People are nominated for both peer and achievement awards, and oftentimes it's a very tough decision. Sometimes we can't even decide on one, so we give 2 awards just because people are so worthy of those awards. So we're really looking forward to honoring the people that we serve at this event. We hope that you can join us. It's going to be here at the Troy location, right here in this room. We'll have food and be able to honor the individuals, and we'll have a couple of presentations to learn a little bit more about some of our programs. We also have, we're participating in the 2nd Annual Family Appreciation Day. We're attending some family farmers markets. So just trying to get the word out there about OCHN and kind of tapping into individuals who are going to the farmers markets. And then also to just give you some updates about some things going on in September. As I mentioned, September is a really busy month. Again, some participation in some of our farmers markets. And then we always participate and sponsor the State Recovery Celebration. It's actually moved from Belle Isle this year, and it's going to be at Freedom Hill in Sterling Heights. So it's going to be interesting to see a different location. I think that's a really good venue. So we're looking forward to seeing how that program is going to work out, that event. We also have our annual Walk a Mile rally that we participate in Lansing, right on the Capitol steps, and that's going to be on September the 13th. We have thousands of people that show up for that event, and they hear speeches, they have opportunity to talk to their legislators. So a little bit more about that next month, but just to get that on your radar that the Walk a Mile event is coming up on the 13th in September. Another walk we have is the NAMI Walk. We participate and sponsor that every year. Another great event that it's important for us to be a part of. We have our recovery celebrations coming up next month as well. That's on the 22nd of September, and we host that event. We actually are kind of changing the venue a little bit this year. We're going to be both inside and outside. We're going to have some presentations inside, and then we're going to have music and food and some entertainment outside, some speakers outside. So trying to change things up a little bit this year. It's our 15th year of sponsoring or hosting the recovery celebration here at OCHN. And then we're also hosting for the County Suicide Prevention Task Force, we're hosting the annual Suicide Prevention Month event here in this room here. And OCHN is trying to host a lot of different events, and we've hosted this event for the past few years, minus the COVID break, but we've hosted this event quite often. Next, I want to give a little update about the anti-stigma team. As you know, it's the CNS anti-stigma team, and they are under contract with OCHN to provide anti-stigma education in the community. They do it both locally in Oakland County, in the metro region area, and even nationally. So, and this program actually even complements our BEST work group, which is the Begin Ending Stigma Today. And as you know, one of our board members, Melkaya Newman, is the lead for this, a supervisor for the anti-stigma team, as she is presented here. Her team is presented here at this board in the past. So just wanted to give you just some data of how much they have been out in the community. They've attended numerous conferences over this last fiscal year, numerous meetings, 133 presentations to give you a number. So they've been very busy. Every month it seems like they were at so many different events, and they were able to impact almost 3,500 individuals. So I think that's something they should be very proud of. So great job. Okay, also wanted to mention some of the press releases that we are putting out this month. We already sent out a back-to-school press release just to kind of remind parents about some back-to-school things. Back-to-school can be really stressful for kids. It can be really stressful for parents. And just reminding them of making sure everybody kind of has ways to deal with some of their stress and anxiety. We also included a resource packet that highlighted a lot of the programs and initiatives that are available to parents and families. We're also doing one for older adults in mental illness or mental health, and we'll obviously highlight our Your Voice, Your Value conference once that happens. And then Overdose Awareness Day is at the end of this month, so we'll be highlighting that as well. And then, as I just mentioned, OCHN is hosting a number of different events in this building. We hosted the Tri-County Peer Connect session earlier this month. Also, Community Housing Network hosted their Regional Housing Partnership meeting. And then, as always, we have our RRAC and CAC meetings here in the building. That is all I have. Any questions?
Not hearing any questions.
Thank you,
Suzanne. Now we're going to other business, or we're in other business, the fall conference.
Hi. As a reminder, we have fall conference coming up, and we're still, they still haven't put it out there for the reservations, but as soon as it does, if you want a hotel room, you gotta let me know sooner rather than later if you plan to attend. Or otherwise, we're gonna put you somewhere else. Traverse City. So it's October 22nd through the 24th. I believe there's going to be a Sunday meeting, so we'll need at least four board members if they plan to attend that Sunday meeting. So if you can let me know as soon as the button gets released to book rooms, we're able to book as soon as possible because they fill up fast, especially in the fall. So just a reminder.
Any questions or comments about the conference? Excuse me. Lost on my agenda. Now is our second opportunity for public comment. Is there anyone online, anyone in the building that would like to make public comment at this time? Mrs. Mr. Cummings? Is somebody, do we have a timer? Okay.
I'll be short. Fred Cummins, Lions from Little County. Different issue. The board meeting announcements are on the internet, and I assume that's primarily meets the requirement for announcing the meetings. But the requirement is not just to announce meetings, but to address or inform people about what the meeting is about. And it does have an agenda attached, but it's a very simple outline, no content. So you're approving proclamations, which you're looking at, but nobody else is seeing those. You're approving contracts, which nobody else is seeing. And part of the reason for having public comment is for the public to comment on the things you're about to make decisions about. So the meeting announcement doesn't do much if people don't know what it's about and can't raise issues about them in public comment. So I would hope that the agenda would become much more complete, possibly with links to everything that you're looking at and reading and approving. It doesn't have to be what we see on the screens here with all the slides and everything, but at least it has to have enough content so people know what you're talking about, know what you're deciding, and can comment meaningfully in the initial public comment. Thank you.
Thank you, Mr. Cummings. Now, Mr. Cummings, could you turn the mic off? Thank you. Now it's time for board member comments. Ms. Sheila, can you call the roll?
Ms. Woodruff?
No comments at this time.
Ms. Root? Dr. Hans? Pastor Jones?
I want to say I think that the planned outreach is very, very good, and I'm more interested, as I know we go forward, in some of the results from all of this. I think we're reaching the people we need to reach, talking the subjects that we need to talk about, and identifying the areas where we can really shine as a organization. So as far as the events, and I thank Suzanne for the work she's doing on all of those. So I think that's really good. As it relates to the contractual agreements, to be interesting to me once we get the report back, having changed the system, what that does, especially if it's going to help us in not only future thinking, future planning. That's going to be very, very important, because I think that's why we got the new system. So it'll be interesting on that. And I can't holler about the snow removal. I'm paying more than you guys. So thank you so much.
Mr. Landsman?
Thank you. I just want to take a minute and thank the staff that are hard at work right now building out our potential budget for the upcoming year and trying to anticipate what our revenue will be coming in from the state and other sources, and as well the expenses, so that we can deliver probably the best delivery of care of any CMH across the state. So to that end, I also want to thank all those that are part of the direct providers and our core providers and their efforts to serve the people that we serve. So thank you all.
Mr. Young?
Just a quick question for Dana and Adam, maybe on transportation. Have you heard anything from county or anything new, or? Okay.
Mr. Cohen? Ms. Newman?
Comments?
Meeting's adjourned, I think. Oh, Dr. Giles. I'm sorry. I didn't see it there.
Well, that concludes our meeting for this evening. I signify that the meeting is adjourned.